A deadly virus that claims the lives of thousands of kids under 5 each year has surged in recent weeks. Cases of RSV are higher than typical for this time of year. There has been an 18.5% increase in cases among under 5s during the week ending on October 16 compared to the previous week. And modelling has predicted that RSV levels may even double compared to a normal year. The recent rise in RSV cases is partly down to COVID lockdowns. The fact kids were forced to stay at home meant the virus couldn't circulate as it normally would. This meant that many children and adults failed to gain any natural immunity to RSV and other bugs like flu. Recent stats from the UK Health Security Agency have shown flu cases are also higher than usual for this time of year and are expected to soar in the coming weeks. It comes as some experts have warned the UK could face a lethal triple mix of COVID-19, influenza and the respiratory virus RSV this winter. This is already the case in the US, where all three viruses are surging in young kids. According to the Centers for Disease Control and Prevention, the US has been reporting about 5,000 RSV cases per week. This is on par with last year, but far higher than October 2020 in the first autumn of the coronavirus. So what is RSV and what are the signs you shouldn't ignore? RSV is a very common virus and almost all children are infected with it by the time they are 2 years old. It spreads easily in coughs and sneezes, and it's mostly under 5s that get the virus. In older children and adults, RSV symptoms include a cough, cold, runny nose and fever. In some cases, RSV can prove deadly. Some children under 2, especially those born prematurely or with a heart condition, can suffer more serious consequences. RSV can develop into bronchiolitis, an inflammatory infection of the lower airways, which can make it hard to breathe. Bronchiolitis usually clears up on its own after around 2 weeks, and you can care for your child at home the same way as you would if they had a cold. Around 1 in 3 children in the UK will develop bronchiolitis during their first year of life. It most commonly affects babies between 3 and 6 months of age. Other risk factors for bronchiolitis are not being breastfed, being exposed to a smoker, and having siblings at school. By the age of 2, almost all infants will have been infected with RSV, and up to half will have had bronchiolitis. Most cases of bronchiolitis are not serious, but see your GP or call NHS 111 if your child has taken less than half their usual amount during the last 2 or 3 feeds. Your child has a persistent high temperature of 38 degrees Celsius or above. Your child seems very tired or irritable. Your child has not had a wet or dry nappy for 12 hours or more. Dial 999 for an ambulance if your baby is having difficulty breathing, is breathing very fast, or there are long pauses in your baby's breathing. Your baby's tongue or lips are blue. You're unable to wake your child, or if woken, they do not stay awake. The NHS says it's particularly important to get medical advice if your baby is less than 12 weeks old or they have an underlying health condition. While it's unusual for children to need hospital treatment for bronchiolitis, the symptoms can get worse very quickly. For the latest health news and stories, go to thesun.co.uk/health.